Hey everybody, American Thought Project here again. Nick and Robert with you. We're here today to talk about COVID again. This is apparently the summer of COVID. So obviously this has come back into the media conversation right now. Today is the 1st of July. So we just kind of wanted to have a chat on what's going on, what do we think we should be done, and kind of where we're at. So recently we've seen a spike in a few states. I know some of the big ones are Texas, California, Arizona, and Florida, as seeing a pretty big resurgence in cases. So I know I'm here in Dallas. Texas Governor Abbott's increased restrictions. They're taking restaurants back to 50% capacity. Bars are closing. So we're kind of going in the opposite direction that we were, I would say, sometime April, June. So Robert, what do you think about I know you've got some data on actual cases and things like that, but what do we think is causing all of this right now, at least to start with?
I mean, I think first to provide some context, right? A lot of things have changed, or a lot of progress has been made since last time we talked about COVID. One being testing is through the roof, right? We're over 30 million tests. We're a number of months into this, and there's still no cure or vaccine, right? So I think the overall context is this virus is going to continue to spread. There's no vaccine for it. That's to be expected. And as testing continues to ramp up, we're going to see more cases, right? Now, that alone isn't good or bad. We don't know. We need more data to truly understand what does that mean? It's an easy talking point. That's why we see it everywhere. Cases, cases, cases. We don't hear deaths, minimal hospitalizations, minimal ICU beds, right? Every headline's around cases, elevated cases. We've got the most cases. Well, let's put some context around that, right? We've tested more than 2x the closest country to us. So of course we're going to have more cases. In terms of deaths, the death rate is actually going down while cases go up. So that would suggest that that's a good trend, right? But let's just be clear at the onset. If there's no cure to this thing, the only option to have a sustainable, life after COVID, so to speak, is to reach herd immunity. There is no, we can say, hey, at first it was, let's slow the spread, right? Let's slow the spread. Let's have our healthcare infrastructure be at a point where it can handle mass influx of patients that have breathing problems. Okay, that makes a logical sense. But it was never stop the spread, because you can't stop the spread of a disease with no cure. You can develop good therapies. You can develop a efficient and effective way to treat it, but there is no stopping of a virus, right? And that's where we are. The mainstream narrative is, well, the disease is spreading, so that's bad. Well, not necessarily. You want the less virulent version of COVID-19 to spread amongst healthy 20 and 30-year-olds, while people at risk protect themselves and take necessary measures to remove themselves from risky situations until what? Until there's either a cure or there's herd immunity. So you and I, it's actually beneficial for society for you and I to get this thing, to develop antibodies to it, and to contribute to herd immunity, because you and I are healthy, young individuals that have over a 99.5% chance of defeating this disease should we get it, right? So I think maybe that's a little tangent, but that's the context that we're in, right?
I feel like that's a direct herd immunity argument. That's if your position is we need herd immunity, then we should just go out and get this thing. But I think the other option you have to weigh is how long it'll take you to get a vaccine. Because if it's not that far off, then maybe we shouldn't all be going out and inoculating ourselves. But another theory that I've been seeing from medical professionals, and again, this is not really a theory, it's a pretty logical explanation, is you saw some states start to reopen, right? The ones that I just named among them. So yeah, we're gonna see a spike in cases. Like, what do we think that there was gonna be no new cases when we reopen? The virus is still out there, and we know that. We're not, again, like you were saying earlier, we're not hunkering down and waiting for there to be no cases.
Right.
So therefore, it is a natural cause and effect of when we reopen, we will see a resurgence in cases. The real question is do we have the hospital infrastructure to handle it? Which was the whole point of us shutting down in the first place.
Right. Which we clearly do, because hospital and healthcare professionals were being furloughed, and entire wings of hospitals being shut down and on the verge of bankruptcy because only one portion of the healthcare system was being used, right?
Yeah.
The repurposing of assets and infrastructure.
I read just a couple of days ago that Houston was actually loaded up with patients that were all of non-COVID related issues because they stayed out of the hospital during the COVID shutdown and then got more sick by waiting and then came in, and that's what
Right.
Houston's problems were.
Right. Yeah.
But that's
so,
like, letting the dog wag, or letting the tail wag the dog, I guess. But
yeah. So I think like we've learned a lot through this process, and we stated our position from the get-go that regardless of what's going on, regardless of what crisis is happening, it doesn't justify the federal government or any government for that matter to start trampling individual rights and individual freedoms. Like, we should largely be left free to judge risk for ourselves and make decisions. The government should not be taking away the ability for me to provide for my family, to use my own labor, my own mind, to create something that gives me a return that I then get to put food on the table with said return, right? The government has no business arbitrarily shutting down businesses. And I think we can more than substantiate the claim that it was arbitrary, because there's absolutely no science behind Home Depot being allowed to be open and the mom and pop shop not, Costco getting to be open, church not, weed dispensaries and liquor stores getting to stay open, and other places of worship not. I mean, there's no science behind that. That's just a prioritization, politically speaking, of what should be open and what shouldn't, right?
yeah,
And I think we learned, hey, this disease is a lot less deadly than people were saying. And the people who claim that, I think they need to own up to it and be held accountable for those claims. I mean, so total deaths, and we'll get into if these death totals are accurate. Peek under the tent, no, they're not, in my opinion, and I'll say why later, but around 130,000 deaths, right? Well, the CDC projected 1.7 million in March, and they used an estimated death rate of 0.8. Well, we're lower than that. Imperial College estimated 2.2 million deaths, and they assumed a rate of 0.9. So this was the data that people were using, and decisions were made on this. And I feel like those folks who either push that narrative without substantiating it any further than, oh, well, the CDC said so, should be held accountable. And should we trust these people? I mean, that's a pretty stark difference. 1.7 to 2.2 million, and we're around the 130,000 range, and we're like shutting down we're thinking about doing it again. I mean, come on, guys. And you mentioned Texas, Arizona, Florida getting a lot of coverage, right? I'm in California. Cases are going up here too, in large part because of testing, right? But what are the deaths per 100,000? All we hear is Florida, Texas, Arizona. Well, the death per 100,000 in Florida is 16. Texas is 8. Arizona is 21.
those numbers are so low.
Are we hearing anything about New York anymore? A little bit. 168. 168. They're more than 20 times more likely to die in New York than Texas, but we're only hearing one piece of the puzzle here, right? I wonder, what does Texas, Arizona, and Florida have what do they have in common?
States. Yeah.
What do those 3 states have in common, right?
Surprise, surprise.
And, California is at 15 low. Well, I live close to Irvine, California. There's a big Chinese population. There is a lot of travel from Asia to Southern California. And, anecdotally speaking with friends who were sick late last year, I think the assumption is, and some studies done by, I think it was Berkeley, a number of studies suggested based on antibody testing data that this thing was here in California a long time, months before, potentially 6 months before, and millions of people have had it, according to extrapolating data from smaller sample sizes of antibody tests. Not perfect, but I think that speaks to densely populated cities in California not exhibiting the same amount of deaths as other densely populated cities across the country.
So I want to talk government response here. So, I was having a chat with some friends and colleagues a while ago, and I was actually pretty surprised that a lot of people do not know. And again, we talked about this in episode 1, but COVID and health is not a federal issue. Health is not in the Constitution, in the Bill of Rights, or any of the subsequent amendments. So, 10th Amendment says if it's not written here, it's a state's issue, and it leaves all powers not delineated in the Constitution, subsequent amendments, to the state. So this is a state issue, which is why, again, you see guidance that comes from the Trump administration, and you see actual law, executive orders, come from the states, the governors. So I don't know what all this Trump administration response is all about. It's not that their administration to deal with. The federal government's job is to back up the states if they don't have the resources to deal with it as need be. So, and last time we talked about this, we criticized governor response, right? We criticized state response, especially in big states like Texas and California, for making wide sweeping orders that were, disproportionately affecting different parts of the states that had wildly different impacts due to COVID. So now effectively we're getting a second swing of the bat here. So what do you think our state and local governments should be doing, and if anything different than last time?
Well, I think they should be doing a lot different. Namely, not doing as much, not giving as many directives. Like, it's the government's job to provide necessary resources to further the exercising of individual liberty and the protection of rights. It's not the government's job to tell you when you can or can't do something based on a certain level of risk. And to your point—
Let me pause you right there and challenge you real quick. What if I make the claim that, for example, people not wearing a mask is infringing on my rights because it is endangering me in public? And that them doing that is by its very nature an assault on my own rights, the right to be healthy. Or is that a right?
I don't think that's a right. That's not a right. Like, you have the right to create an environment for yourself that is most conducive with furthering the various actions you want to take, but you don't have the right to tell someone what or what not to wear. That just isn't a legitimate power that the government has to say you need to put something on before you come out into the public. That's just— there is no way you can uphold that. And there's a reason why people aren't getting arrested, and if they do, they win. And the courts know that that's utterly untenable from a legal perspective, because the government just has no right to force you to put something on your face.
I mean, if government has a compelling interest, in which case health and public safety is a compelling interest, they do have ability to make law that influences it. For example, in the past, you've seen people that like knowingly had HIV and AIDS have sex with people that did not know. And so you could make the argument that they intentionally inflicted them. And there were criminal charges and civil suits brought because of that. So how is that any different than people negligently going around behaving in unhealthy ways, which you could make an argument that if they're not wearing masks in close confined areas, they're acting with negligence and therefore infringing on your rights.
Well, first, the science would have to be settled about mask. An article today
Very true.
came out from let me tell you real quick. Shoot, where is that article? Well, essentially, the microns of a virus are so small that a surgical mask does nothing. So there's not even settled.
I think it was like 1 micron for a coronavirus particle. A mask protects up to like 2 microns, so it's too small, something like that.
Yeah, here it is. The Association of American Physicians and Surgeons came out with an article today, essentially saying that the droplets are so small that these masks, they're really not doing much. You've got to have a number of different PPE materials on to really reduce the risk of this virus getting through. So like that bandana ain't doing anything, that cloth mask ain't doing anything, and the surgical mask, wear one of those like little thin blue surgical masks and go scrape popcorn off of a ceiling and take a picture of your face afterwards. Tell me what it did. Those little dust particles from the popcorn ceiling are about 100 times larger than a virus. Anyone that doubts me, go do it. Take a picture of your face, post it in the comments, and you can prove me wrong. Until then, I'll stand as the one that's correct on that. But for that argument, first, science would have to be settled for that. But I think even the argument, and not to get too much on a legal rabbit trail, but I think there could be an argument made with the HIV thing that's government overstepping their bounds, because each individual needs to make a personal decision based on risk for themselves. Those people who had sex with folks that had HIV decided to accept the risk that there could be a sexually transmitted disease before they had unprotected sex. So I think that whole situation is unreasonable. Do what?
That seems unreasonable to me. That's like saying I take the risk of that my taxi cab driver is a serial killer every time I get into a taxi cab. And if I get whacked, then too bad. Like, you took that risk. I think that's an unreasonable assumption of risk. But we're getting on a tangent here. I think the point that I was trying to get towards is, guys, it's summertime. It's summertime, and we're seeing this thing ain't going away. So I think we're going to find some way to learn to live with this, because we cannot be opening and closing. Like, we know that's not going to work. We know we can't shut down the economy again. Like, it's just, sorry, it won't work. So how do we learn to live with this within the confines of the law, but with the preservation of liberty in mind, and also just with general decency in mind? Yeah.
So I think we've got to assume that there's no cure. And even if there is, not everyone's going to take the vaccine. Because not everyone wants to take vaccines. I personally don't get the flu shot every year, and I've never had it. I'm not a big, proponent for taking things you don't necessarily need. I much prefer the method of eating right, supplementing right, working out, having an overall healthy immune system. To me, is the better method, and that's my personal choice. So the government doesn't have a right to force me to take a vaccine or inject it into my body. Right?
I don't think anyone should be
So
compelled.
I think we've got to work under the assumption that the only life post-COVID, if you will, is to achieve herd immunity and to have effective, efficient treatment methods that continue on this is good news, guys. Over 99.5% chance of beating this. Majority of the deaths are multiple comorbidities, 70, 80 years old. The average death rate of COVID is higher than the average life expectancy. So, this is good. And again, we're not saying that this is nothing, but to think that it is as serious as the folks saying 2 million people were going to die, thought it was, is just disingenuous or willfully ignorant, or just okay with lying for a specific agenda, right? So on the note of herd immunity, remember Sweden was getting all types of flack, tons of flack, because they never shut down. They didn't do a whole lot. They just said, hey, our citizens, we're going to trust them to make good decisions. Here's the guidance. We're going to probably tiptoe the line on what our government says we can do, what our penal code and what our constitution says we can do, but they never fully shut down. Well, their deaths per 100,000 is 52. Let me remind you that New Jersey was 168. That's a little over 3 times the deaths per 100 is Sweden, who never shut down, right? So that maybe that's the reason you don't see a headline with Sweden in it anymore, because they said from the onset, hey, we don't see a cure coming in the next 6 months or maybe even a year, because these things take time, right? And the coronavirus is similar to a flu, and the flu shot isn't even always effective because diseases, viruses mutate so quickly. So they said, hey, I mean, we can't afford to shut down, not shut down, go back to shutting down over the next 6 months. We need to get to herd immunity. That was their approach. And I think the data suggests there's some validity to that. So yeah, I do want to touch on real quick. Earlier I said, hey, I think 130,000 deaths is inflated, right?
Okay.
So I just wanted to make a couple quick points as to not just make a claim without backing it up. So there is a number of data points that prove this. One being Deborah Burke saying, if someone dies with COVID-19, we are counting that as a COVID-19 death. They die with it. You can die of a lot of things. You can have COVID-19 get run over by a car. That fits the description here. So the case definition is very simplistic, right? Burks and others are also concerned. This is a quote from an article. Put the link in the comments, or I'm sorry, in the description. Burks and others are also concerned that the CDC's antiquated accounting system is double counting cases and inflating mortality and case counts by as much as 25%. The Centers for Disease Control guidance explicitly acknowledges the uncertainty that doctors can face when identifying the cause of death. When coronavirus cases are, quote, suspected, end quote, the agency counsels doctors that, quote, it is acceptable to report COVID-19 on a death certificate just because it was suspected.
Okay, so what's your point? So what? Deaths are inflated by 25%.
That means it's even less deadly. I mean, the point was this is a hell of a lot less deadly than we thought.
Okay.
With the standing data point of 130,000 deaths, my point is, of those 100,000 recorded deaths, they were not all due directly from COVID. I think I mentioned on the first episode then, and I have more examples now of people I know who have family members who were in their 90s who recently passed away, and it says COVID on their death certificate, and they're going through the legal process to fix that. I have another friend who works at a nursing home who was talking about the problem of elderly people, specifically with dementia, that will not eat unless a loved one or someone they know or recognize that comes to visit them frequently feeds them. And these people were dying of starvation and getting classified as, malnourishment and starvation, getting classified as COVID deaths. Now that just is one of the saddest things of this whole, it's so infuriating that that's happening. I mean, this is a, firsthand primary source of a guy who works at the nursing home who's like, this is a problem. And these people give up. They give up because they can't see their family.
Yeah, and kind of related to this point in this topic, I want to, kind of as a last point here, I want to address the political optics here. So I have to admit, I feel pretty bad for all 50 governors. They're in between a rock and a hard place. On the one hand, we've got a huge cultural movement in the country right now, the BLM movement, which is, for whether it's peaceful, not peaceful, that doesn't matter. It's creating huge assemblies of people, which is quite opposite of what COVID guidance avoidance was about. So they're grappling with protests, lawless, huge groups of people, doesn't matter what's happening,
Right.
and COVID-19. Then you have media that has an economic incentive to keep this in the news cycle because they're getting huge viewership, because fear mongering is like the most effective tactic at getting viewership, like in the history of television. So, I mean, what do we think about, both sides of the aisle and their reasons or for either downplaying the risks? Maybe you could say that on the Republican side, and then why is the political left, the Democratic Party, pushing the fear mongering and having an incentive to elevate that?
Yeah. Well, I think first and foremost, there are more examples than we could possibly go through in one day that show the utter hypocrisy as it relates to COVID guidance and specific actions that citizens want to take, right? There was a very different media narrative behind people wanting to open their businesses so that they could provide for their families from the media. And then there was a different response to people who wanted to protest violently or peacefully, doesn't matter, right? To your point, it's a large group of people. There's a very different response from the media and from politicians. One was condemned, one was celebrated. Now, it doesn't matter if you agree or disagree with either of those. The point is, there was a different response, and it was because of a political agenda. Because you can't say it's okay for 10,000 people to get in a narrow corridor of a street yelling and being close and touching each other. You can't say that's okay and then opening your business that has 10 to 20 people in it at one time and taking the necessary CDC recommended cleaning guidelines is not okay.
Look at the Trump rally, the Oklahoma Trump rally. That was just this huge spectacle of just COVID irresponsibility when, literally at the exact same time, there were huge gatherings of people in protest. Like the media hypocrisy there was just shocking to me.
Yeah, it's complete hypocrisy. There's no consistency in it, right? So I think that's one thing. I think from the get-go, I actually disagree with a lot of Republicans and Democrats, regardless of where you sit on the political spectrum, their responses, because both sides were pushing to some extent or another what I feel is illegitimate courses of action being taken by the federal and state government and overreaching powers of the government, right? But to me, it's beyond the political or economic factors. There's a moral reason to why the government shouldn't be acting in a way that strips rights away from its people. The sole and just reason for a government is to further secure and protect the rights of the individual. And we've unfortunately seen in many cases the government do the exact opposite. Now, you can agree with the outcome that the government achieves, but that doesn't mean the means to achieve those outcomes was justified in the first place. And it definitely sets a dangerous precedent whenever the goal changes. That, the government can now tell you, you know what, you're not allowed to work right now because something bad's happening. You know what, you're not allowed to freely worship whatever deity you choose to because something bad's going on. We're going to decide for you what you can and can't do. Like, that's a dangerous precedent.
And the only solution I see to that is they have these orders that if you feel you're subject to an unlawful order, whether it be a city, a county, or a state government, they need to be challenged in court.
Yeah,
that's the only way to get them out.
Yeah. Or peaceful civil disobedience, like Elon Musk did, right? And you continually see various. I mean, even the sheriff's department in Los Angeles County, which is definitely left, they're not enforcing any of Gavin Newsom's orders to shut down the beaches over July 4th weekend. Why would you order the beaches to be shut on July 4th but you don't order the streets to be shut down when there's protest. There are thousands upon thousands of more individuals in closer quarters protesting in the streets than there are going to be on the beach on 4th of July, right? It's just utter hypocrisy. So, but my point is, through peaceful civil disobedience, you have the individuals responsible for enforcing laws or gubernatorial edicts backing off because they know it's a dereliction of duty. It is
Yeah, public opinion can go a long way there, but I have to add here, because I have criticized a lot of like violent protests in the BLM movement. If you choose to engage in civil disobedience, I'm not going to say you shouldn't do that, but you better be prepared to pay the consequences and get arrested and pay a fine if you get locked up for it.
Yeah. Yeah.
Doesn't matter what side of the aisle on, doesn't matter what the issue is. If you decide that civil disobedience is the route that you choose to take, you better be prepared to pay the consequences, and do not go crying when you get thrown into a van.
Yeah. Just like the salon owner in Dallas, right? She was prepared to pay the consequences. She didn't get violent. She didn't organize any violent protest or any destruction of property or any condemnation of police officers, but she was willing to make a point. She did, and things changed. So that is like a perfect example. Both her, we keep on going back to Elon Musk, and her are perfect examples. Like, you're willing to pay the price. Elon Musk said, if anyone gets arrested, let it be me. Like, he made a stand. And I think that's a great point on, you can achieve political outcomes that are based on a moral premise without destroying things illegally, without causing violence, without attacking innocent people. I think we have recent empirical evidence on what works better, right?
Yeah.
But yeah, I completely agree. But I mean, to your point at the onset, we've got to get used to living with this.
Yeah.
And we've got to check the government whenever they decide they're going to overstep their bounds and try to regulate every area of our lives. So we've learned a lot from this COVID deal. We understand that it is something that is a risk and is dangerous, and we don't like it. But we also have to be intellectually honest and admit that it's not as bad as anyone said. It's not pleasant, but we're nowhere near.
Fact. It's not even debatable.
It's not even close. And the narrative that's being pushed right now is against states that the mainstream media didn't like what they were doing, but still have better numbers and outcomes than the states that they, quote, did like what they were doing. I mean, so yeah, it's just, it's crazy that we're going to see this come back. I don't think we're going to shut down again.
No,
But
we can't.
The inability for the media and for politicians to show a like kind of three-piece scenario of, this is what we thought, this is what happened, these are the results, this is what we're going to do based on that, is ridiculous. That's the role of the government, is to provide that. And they're not doing it. They just want political ends. I mean, I think, can anyone honestly say that some politicians aren't using this to achieve political ends?
Oh, no. I mean, both sides definitely have a lot of incentive to keep it going.
Yeah.
Remember, just like any other problem, if there's no problems, then you don't need someone to solve it for you.
Right.
And that's what politicians are trying to push the narrative, that they are here to solve all your problems. But I think the point that I would close with is, we need to be decent to one another, right? And we're going to have debates on what the best methods of living with this thing are. I know we're seeing, huge paradigm shifts in the way that we work, the way we go to school, all these things.
Mm-hmm.
We just need to think about them critically. We should not be making knee-jerk reactions, and we should always keep an eye on government overreach.
Yeah.
Because again, I say this all the time, government power only flows in one direction. Once it's given to government, it cannot be taken back peacefully. So we just have to be very, very cautious that you don't wake up and your liberties are gone.
Yeah. Yeah. I think for me, the overarching learnings from all this are: one, the media and politicians lied to us.
Yeah.
Best
Uh,
case, they were
I don't want to
willfully.
say lie. I would definitely say we're misinformed, but had incentive to not change the narrative.
Yeah. Okay. I'll give you that. At least 2 months in, they were either willfully ignorant or lying.
There you go. There you go. 2 months
They
in.
definitely made crap decisions based on crap data, and we went through all the fear mongering of crap models and everything else. And the media, for sure, if not politicians, damn sure the media has been lying about it. And I think that teaches us we need to be critical of these things before we just willfully give up freedoms, if at all, right? I think we're seeing good trends in, yeah, upward ticking cases sucks and it makes people scared, but deaths going down, that's a good thing. And
Yeah, for the record, you do not have the right to not be scared. Just throwing that out.
And I would encourage everyone to do a little research on the recording of deaths. Talk to some healthcare professionals. Check out the links that we're going to post in the description. I mean, there's some nefarious business going on. We didn't touch on the financial incentive that hospitals have to classify people.
Touch on that last thing.
Yeah. So, and at the end of the day, we're never going to be able to quantify the negative consequences of the actions that were taken in terms of the correlation between GDP and unemployment rate and mortality rates, suicides, domestic abuse, alcoholism, cancer screenings going not done, cancer not being diagnosed, pain-related surgeries. I mean, and then from a moral perspective, people dying by themselves without families near them, not getting to say goodbye in person, not getting to have funerals, not getting to practice their religion and worship. Like, these all have weight. And unfortunately, we will never be able to fully quantify those things. So I would encourage people to really wrestle with that and
always be aware of second, third, and fourth order effects of things that you do.
For sure. And at the end of the day, I mean, I think we aligned on this last time, and I'll say it again. No crisis or scary thing or potential threat to our well-being even justifies stripping you of your God-given inalienable rights. Government should never be doing that. They have to have your consent for these things. So with that, until next time, thanks for joining American Thought Project. Like, share, subscribe, comment with your thoughts, and we'll talk to you next time.
Till next time.